Welcome to the Asking Why podcast. I'm your host, Clint Davis. I'm a marriage and family therapist and licensed professional counselor trained in trauma and addiction. The Asking Why podcast is for anyone on a journey of healing and restoration. If you are searching for answers to life's questions and want to learn more about root causes from a psychological and theological mix, this show is for you. In this podcast, myself and a co-host from Clint Davis Counseling and Integrative Wellness will interview guests on a wide range of topics in order to get down to the heart of the problems facing our world and understand why things happen and how to change the world and ourselves for the better. Want to learn more tips and tricks to living a healthy lifestyle? Visit us at Clint Davis Counseling and Integrative Wellness on Facebook and Instagram. If you want to meet our staff or book a speaker, go to clintdaviscounseling.com. Thanks for listening and be sure to subscribe today. Okay, Dr. Mandy Crow, welcome to the Asking Why podcast, episode 24.
Thanks, Clint. I'm glad to be here.
Absolutely. Glad to have you. So for those listening, Dr. Crow is part of our integrative wellness team. And so kind of today, the goal of the podcast is to talk about what she does, to talk about kind of what services she provides to our community, but also just talk about medication and mental health and how all this stuff plays together so that the average person who's out there, maybe they're not happy with their doctor, maybe they're not happy with their insurance, maybe they need something special. And so we're going to talk about some different options that people can get with direct primary care and kind of what she's offering for our services. So that's the goal of the podcast. So part of our integrative wellness goal at Clint Davis Counseling is to have doctors and chiropractors and different providers who are on our team who we can refer people to that we know are also going to be looking out for mental health issues. So if you go to Dr. Crow, for example, she's going to be thinking, oh, this lady had a miscarriage or this person has this issue. And hey, I know that they're seeing Clint or they're seeing somebody at the practice. So I'm going to incorporate that into what we're doing. And so we've had Dr. Jen on here and some of the other integrative wellness partners. So today we're just going to have you on here and talk about what you do and who you are. So
cool. Glad
to have you. Tell me, and for those listening, kind of your story, where you're from, and then what led you into being a doctor. And
okay. Well, I consider myself a small town girl. I'm from Benton, Louisiana, so haven't strayed very far from the area. Over the river, which, you know, growing up, you're like, oh, you know, you don't go over the river very
You go to the big town of Shreveport,
but I found my way to this side of the river, so that's cool. And so, I grew up in the Benton-Bossier area and was point guard for Airline High School and played basketball all my life.
Nice.
And then I went to Louisiana Tech for college, which I absolutely loved. And, you know, I always joke kind of just far enough to have some autonomy and feel like you're making your own decisions, but close enough when I needed my mama or my grandmother or, you know, I could come on home for the day or whatever. And so that was a very nice balance there. And that's where I met my husband, Kelly, and we've been married for 15 years. Nice. And so right after college, I was thinking this morning, I told him, I said, I think sometimes, you know, you forget where you've been. You get into the grind of raising kids and a career and you kind of forget, wow, you know, we had no clue what we were getting into. We got married a month before I started med school. And man, you know, starting out a marriage and med school at the same time was very challenging. And
absolutely. What made you want to go to med school? Like, what did you do your undergrad in?
So I started out in business, and I wonder, too, if that kind of how I eventually ended up owning my own business, which I never thought I would. But I started out in business, and I started taking, you know, the required biology courses and everything like that, and I just loved biology. And a couple of the professors over there I really liked, so I just started to get pulled into that field. And always, you know, I knew I wanted to help people, and so those two kind of just mesh well together, learning the systems and the body and biology and wanting to help people. So it just kind of pulled me in that direction. It wasn't a lifelong goal. I don't come from a family of doctors or anything like that. It just kind of came about by taking different classes and things like that.
So at that point, were you already a Christian? Kind of how did that all work out?
Yeah, so I was raised in the church, a little Methodist church in Benton. Yeah. And had been baptized as a baby and always been a Christian. I think, it's one thing to kind of just accept what your parents teach you and another to learn it on your own. And so I think that happened probably after college. I probably took a not a step back, but, when I would come home, I would go to church, but I was not.
It wasn't your faith.
It wasn't my faith, and I wasn't completely involved in college like I should have been, or.
That's most of us, yeah.
Always having that presence there and having that relationship, but definitely wasn't deep, and I had not learned on my own and formed that like I have since I've started my own family and kind of grown in that direction. So. Okay,
so college, you're doing that, loved biology, and then you switched and just decided to go to med school.
Yeah.
Because you just decided to do that,
right? Right. And then, trying to get in is a whole nother thing, and then you start taking all the courses and all the MCATs and trying to decide what you're going to do. And
what's Kelly do?
He is in construction management.
So was he doing that then, or was he in school too? Or
he was still in school, and he had just graduated probably 6 months before I did. He was living in Dallas, and we were kind of long distance relationship, and trying to figure all that out. And then we had talked about it some, but then surprised me and asked me to marry him, and nice. The rest is history there. So yeah, it was trying to make all those choices and transitions at one time. I regret not having a closer relationship with God, because I think, having his guidance and his hand more in it, I think probably would have, maybe not made things smoother, but been more at peace with some of the things that were going on. But I think, he definitely was there and helped guide me into the path that I needed to be on, whether it was in a roundabout way or not.
So you decided to do family medicine? What did you go into med school for? Like, I don't know anything about it, so how's that work?
Well, so some of the reasons I chose that path too were, and we'll get into some of the mental health aspects. So some family history that I had really made me want to go possibly do psychiatry. And then I struggled big time with acne my whole life growing up. So I thought, I really want to go into dermatology. Yeah. So there was all these different interests there. But when you go into med school, it's getting better, or it's changing where you do see patients earlier, but it's a lot of book work in the beginning. So you just learn about all fields, everything, every system, physiology, how the body works, how it gets diseased, and you're in the books in the beginning. So it's not till third year that you really start to do clinicals and start to see and interact with patients, which it may be different. I've been out a few years now.
Things change. But that's not that long ago. Right?
No.
Yeah. You've been out a little bit, but it's still not that long ago.
Right. And so that's when you start to dabble in the different fields and try to learn, what is the right fit. And I think I just liked so many different things and I, was a people person and felt like, one-on-one with individuals. So family medicine just kind of felt like the right fit. And you decide that probably your late third year, early fourth year, what field you want to go into. And so, and then, to be a dermatologist, you got to be in the top, one or two of your class, and I wasn't there. So.
Kind of ruled that out.
Like, well, I'll do it in family practice style.
Yeah, for sure.
So yeah, I'm able to incorporate mental health, all these things that interest me into one field. So yeah, it was cool how it ended up that way.
And so you graduated, and then what happened?
Well, so I had a baby. I was pregnant my third year, had a baby my fourth year of med school. Which was another one of those decisions, you just make blindly. Gosh, you don't know what you're getting into. Like, let's just have a baby, okay?
Yeah, it'll make everything easier and better.
And, cannot state enough the support from my family and friends. And Kelly's parents came and lived in our driveway in an RV for a couple months, and to help us, because, I was studying all the time and he was working, and So it was pretty crazy. I remember many, 4 a.m. on trauma surgery with a big old belly, running up and down the stairwells and holding traction in surgeries for 8 hours. I mean, it was pretty crazy.
Yeah, it's intense.
And then graduated, and one other thing I will say about Kelly is the support he had through my whole med school and friends and everything. But without him, I would not have made it. I mean, there was many a times that I just, okay, Kelly, I can't do this. I've got to quit. And he would be like, okay, let's figure out how to do that, or what do you need? It was never a pressure or a disappointment, and I think that just kind of gave me the okay, all right, well, I don't have to, but I really want to do this, just gave me the confidence to get through. So
that's awesome.
I thank him a lot for that. I don't tell him enough.
Shout out to Kelly, and does a great job during that. Yeah, for sure, especially working and having a baby and trying to figure all that out. I can see where under pressure you want to just bail, and that seemingly will make everything better.
Right.
Yeah, I think we've all been there before. You get under the pressure cooker and you're just like, I got to make a decision so all this is better, but really it might not necessarily make it all better.
Absolutely. So graduated, and then we headed down to Lake Charles. That's where I did my residency,
okay.
And that's where Kelly's from and all his family was.
Okay.
So we have a pattern of being around family.
Yeah, it's good.
Because we definitely, we thrive off that support and those relationships.
Mm-hmm.
So headed down there and met a ton of great people and had great faculty and just really enjoyed residency and doing some real world, medicine. And it was a community-based hospital, so we kind of...
What was it? What hospital? Put you on the spot.
Oh my gosh, I just blanked. Memorial.
Yeah.
Memorial Hospital in Lake Charles.
Okay, cool.
So we were kind of the main residency there, and so we saw everything that walked through the door and just got a lot of different experiences, and was able to get a well-rounded experience there instead of just having all these other residencies around that took the neurosurgery cases or the heart attacks or that sort of thing. We saw everything. So
and so your daughter, right? You have your oldest is a girl, or your
so my oldest is a boy.
Okay.
Yeah, Aiden.
That's right.
Just turned 12, and then I had Caroline while I was in Lake Charles.
Okay.
So
I was trying to do the math and figure out when that was.
Second or third year down there. I can't remember what year. We had her, and then finished up there and came back. To this area. And so trying to decide, where to end up, that was very difficult because we had pool down there, and we wanted to stay in Lake Charles, but also there was a lot of great opportunities here in Shreveport, and so wanted to kind of test everything out. Interviewed at a lot of places, and just kind of felt a draw to come back to this area and be with family up here, and really clicked with the group that I started with.
And where was that at?
That was at with Dr. Flake, Dr. Self, Dr. Moses, and Dr. Carr.
Okay.
Here at a hospital system.
Nice.
And you just kind of hit the ground running. It's pretty crazy. You don't get a lot of real world clinic advice or how to run a clinic, or you're in with all these other doctors in residency, and you have people to bounce ideas off of, and the support system, and then it's like, okay, you're it now.
Yeah. It's very much like that in counseling as well. You're in practicum, and you have all these supervisors and these teachers, and then you graduate, and then it's like, okay, here's clients, and
right,
here's your job, and it's like, oh man.
Yeah, so that transition is, for me anyway, it was definitely scary in the beginning. But
that's a lot for everybody.
Man, the colleagues I had, though, they were, I know they got tired of me in the beginning and asking a million questions, but they were very supportive, and it was a great clinic to be in with to start out.
Yeah.
And then I think, medicine is funny. I loved being a primary care doctor, but the system that has been kind of, built around the practice of medicine, I did not function very well in. And it took me a long time to kind of come to terms with that and try to understand, why can I not make this work, or why am I so miserable or stressed out or burned out is the
typical
the key phrase now after I've only been doing this, 2, 3, 4 years.
Yeah.
Is there something wrong with me, or, what is it that's
that dang Kelly should have let me quit a long time ago.
Right. And so I think, we don't really get to choose, or I didn't know there were other choices out there when I started. And so you just kind of go along.
Well, and there weren't much.
Right.
Right. I mean,
I think the trend was changing. Everybody was private for decades, and then everybody started to be employed because of just the burden of electronic health records and insurance and billing and all of that. And so, that was just the typical route of graduate and go get employed. And
you get employed by a big system that has a bunch of moving parts that you're not in control over, and you show up and you get a salary and
right.
Yeah. And then you're seeing how many clients a day?
Yeah. So it just, it depends on how busy one wants to be or needs to be or can be. But for me, I was probably seeing 25 to 30 at my max. And that was overwhelming for me.
Yeah.
Very overwhelming. And I wasn't even seeing as many as, most doctors do. And so I felt, what is wrong with me? Why can't I do this? And I think if you ask most doctors, one huge aspect of that is the electronic health record and the amount of charting you have to do and clicking boxes. And it would add every year, now you need to do this, and now you need to do this for insurance and billing. And I think that just takes your time away from the patient. Mm-hmm. And that's why we all went to med school, is to help people. And now we're doctoring our computers more than we're doctoring the patient. And I think that's not the only aspect, but that's one big aspect of why it just was not a good fit for me.
Yeah, for sure. And I know, we've talked a bunch about it, but, for doctors out there listening who live in that lifestyle, it's not a hate on them. It's just didn't fit for you.
Absolutely. Yeah. I mean,
some people can do it and love it and thrive in it, and that's their
yes.
thing.
And all my friends are in the traditional model, and they all are doing very well and great, and they help a lot of people. And yes, it is no
knock on that
at all. I mean, that works very well for a lot of people, but just for me, I think my mental health and my ability to function at that high of a pace was just wasn't there. And so I needed something different.
And so that brought you to what?
And so that brought me to direct primary care. And I was trying to think of where I even learned about it or heard about it, and I don't remember, but that bug started to get, or I heard about it about 2 years into my clinical practice. And I was like, wow, that sounds interesting. I didn't know there was such a thing. And so, I would constantly read articles and go to conferences and just start to slowly get into that world and see what it was all about and talk to different people and learn the pros and cons and just really try to learn as much as I could about it to see if it would be a good option for me. Because it was like, okay, should I leave medicine, or is it just the system I'm in, or what is it that's not making me feel fulfilled or in my career? And so it was kind of like the light that I needed.
Absolutely.
And so direct primary care was this way of, so basically what it is it kind of pulls out the middleman in medicine. It allows the doctor and the patient to be back, as the center of the relationship. You don't accept any insurance. You're paid by a monthly membership, and then you're able to just kind of take care of the patient from there. So you don't have to worry about coding and ICD-10 codes and charting 8 pages for a sore throat. You're just able to simplify medicine back to the way it used to be, and that's been extremely rewarding.
So you started that when?
I started that in August of 2019, right before the pandemic.
That's a great timing, right?
Yeah, who would have thunk?
Yeah, God's got a sense of humor for sure.
Yeah, so that's what I'm doing now. I am a direct primary care physician, still have the same, do the same thing and still take care of the same conditions, and still board certified in family practice, but just do it in a different model.
Yeah, so for people listening, tell them kind of in detail what you do, what are your services. So if they're in our area, especially Shreveport and Bossier,
Sure.
Yeah, give them the stuff.
Okay, so for a flat monthly fee, you basically get access to my clinic and primary care services. So that includes almost everything that I do and everything that I can do in my clinic. So everything from office visits, I can communicate in different ways than a traditional clinic. So we text, we email. Now a lot of doctors are doing telehealth visits, but even before that, video visits, phone visits, instead of having to take off work for every visit, that's all included in that monthly fee. So if you needed a antibiotic shot or a breathing treatment or EKG, all that is included in the monthly fee. There are a few extra things such as a flu test, steroid shot, sewing up a cut, taking a skin biopsy, but all those are under $30. So
wow.
We're able to just take out all that administrative burden and lower the cost of care to kind of actually what it is.
Yeah. Yeah. I mean, I remember, JC and I, when we had Jude, we do Samaritan Ministries or Samaritan Sharing or whatever, so we don't have insurance. And it's been phenomenal. I mean, we've had it for 4 years now, and it's been great. So we just pay a monthly thing, and then we pay cash for all of our services and all of our stuff. And I remember you get a bill back, an itemized list, so you can turn it in and get reimbursed. And it was like $800 for oxygen.
Yeah.
And I was just like, what? It's like we live in this world with like medicine and doctors, and we don't ever see the itemized list usually. Our insurance pays it. It's like when you actually have to look at it broken down, it's pretty outrageous.
Yeah,
and because of all those things you're talking about,
right.
because of the cost of doing business.
Exactly. I mean, I think they've got to recoup the cost of paying all these people to build insurance, and it's just a huge conglomerate that has to be fed.
Yes, for sure. So you're able to kind of go, what's it worth? Where do I make my money? Or how can I have this lifestyle that I want, but also how can I serve people and get
exactly a much
service.
better work-lifestyle balance. And then also, I would get so frustrated seeing patients getting $600 bills in the mail for labs. And well, if you would have just gone 2 doors down to this lab, it would have been covered, differently, and you wouldn't have paid that much. And then when you actually see, what the cost is, setting up a direct payment system with the lab, you can get things much cheaper. So that's another part of it, is I've gone out and I've done the legwork, working with different labs around the city, getting lower pricing, so they direct bill me, so they can lower their costs too. And so it's just a win-win for the patient. They get cheaper labs, and then a win for the lab because they don't have the administrative burden to collect their payments. They just get it straight from me.
Right.
And then I also dispense wholesale medications from my clinic. So generic medications, a lot of times cheaper than you can get them at the pharmacy, sometimes comparable, but the efficiency of just grabbing them from me before you leave, patients like that. And
yeah, for sure.
Spending a lot of time at the pharmacy waiting on medications and prescriptions to be called in. So that's another perk. Another big perk is no wait times or very low wait times. So my patients joke, like, when am I ever going to get to sit in the waiting room? Because I'll get some coffee in there. And
that's awesome.
And different things. So it's usually just...
Yeah, because when you walk in, I mean, you just stick your head out and say, hey, what's up?
Yeah.
Yeah.
There's usually not a lot of patients waiting in the waiting room like, hey, Miss So-and-so, come on back. And so that's really, I think, important for people because our time is so valuable. And I know I would just get so anxious because I'd have so many patients waiting and, somebody's late, and so it pushes everything back, and it just can kind of create this crazy chaos for the day where this is just, a few patients scheduled each day, and so I have much more time to spend with each one of them, but then also be more respectful of their time too. So
absolutely, yeah. I mean, I think one of the reasons I loved like what you do and bringing you part of the team is like especially for most of us who have anxiety, who have experienced trauma, who have, had issues, sitting in a waiting room with everybody else is terrible. I remember when we had our miscarriages, like sitting in the OB's office with all these pictures of babies all over the place for 45 minutes or an hour and a half, to wait. And then you go in for 10 minutes and then you leave.
Right.
So like you're gone 2 hours from work to go in for 10 minutes, and not only that, but like you're sitting with all these other people, you're looking at all these other pregnant women, it's just all this, like, you feel like you're in this little factory, of people.
Absolutely.
And,
yeah.
And so I loved like coming and meeting at your office and seeing your office and being like, oh man, this is super homey. And, people were just able to come in and say, hey, and
yeah,
you feel like you're getting like one-on-one attention. I mean,
yeah, there's just two of us there, and me and my office manager, which about to make some transitions there. I am going to get a nurse, so
Awesome.
So it's very personable. Like, we all know the patients, we all know who's coming in, who's who needs what, and so it's just kind of simplifying. I felt everything got so complicated with so many hands in the pot, things got lost, and not that our system is perfect by any means, but
sure.
Simplifying things helps us take better care, not better care, but more efficient care of our patients.
It makes you feel like you're giving better. I think that's
Yeah.
the most important thing, right? Is like for you as a doctor, you feel the most congruent doing it the way you're doing it.
Yes.
So you
right.
feel like you're giving the best care possible.
Exactly. And not that, I think that's a good way to put it. Like, I'm not giving any better care than another physician, but it's just, for me, I feel more at ease and more fulfilled, and like I'm able to give the time and the energy that I felt I wasn't expending before.
That's good. I mean, I think that's so important for people to listen anyway, in general, when they're listening to anything, is that just because somebody's doing something different than the norm doesn't mean that they aren't better or doing it better or whatever. It just means that for them, I mean, that's what we all need to be striving for, is what do I feel congruent with? What do I feel like is my best self and my healthiest version? I talk about that all the time with our therapists. I'm like, I don't care how many clients you see a week.
Yeah.
If 4 people a day feel super good and you feel like you're giving a game every time, do that. If that's the salary you want and that's the income you want and that's the help you feel like you're doing, great. Because you're going to be bringing your best self to the table when you're doing that. But some people can see 7 people a day, 8 people a day, and they feel great.
Right. And I think it's just whatever threshold you're comfortable with. And I think, I felt a little bit of a fraud, telling all these people to, have a better work-life balance and reduce your stress. And, and here I was, running myself into the ground. And so finally it was like, okay, Mandy, like, you got to quit telling them this if you're not going to do it yourself. And
I've been there. Yeah, for sure. I mean, getting an assistant, like getting an administrator and doing all the things we've had to do in the last 3 years of, 4 years now of this practice. It's like you have this moment where you're like, okay, I'm in my office telling people to self-care. And when's the last time I took a break? When's the last time I told people, no, I can't see you, and you're right. You want to be as authentic as possible.
Yeah, absolutely. And it, I think that if I would love to encourage people in that route, like if you need to make any of these major life changes or life decisions, just because you're stuck in one rut, in one system, it doesn't mean you can't step out in faith and change directions. And
absolutely,
of course, having a good support system, having a plan. I mean, I didn't just go out
wing
it. And it did take a lot of faith, lots of prayer, and
continues to.
Exactly.
Yeah.
But sometimes it's, whether it's a relationship or a job, I feel like so many people are unhappy and unfulfilled with their jobs. Whatever it may be.
I mean, I told you this the other day, right? And it's like, yeah, there's so many people that come in this office that are miserable in their work and make $5 million a year.
Yeah.
It's like nothing, soothes your mental health more than doing something that you love, feeling comfortable with it, feel like you're doing everything that you want to be doing and are passionate about it. And then the money will either happen or not happen, but you'll be happy.
Yeah.
The rest of it, man, people chase that all day long.
And then you just
and they're
still
miserable.
Wind up unfulfilled.
Yes. Yeah, they lose their kids, they lose their marriages, they lose their purpose in life, and, they're stuck in a job going, well, I have to do this.
Right.
And part of, coming to us is like, well, let's break that down. Let's talk about, what do you have to do?
Right.
Like you feel like you have to, let's go underneath that and go, is that true?
And I think too, it's so or at least crucial for me to find mentors or find, who has already paved the way, who has already done this, and who can you seek guidance from. And that's, what got me through it too, is finding those mentors and people that have already done it that can, what was your mistakes? And not that I'm not going to make my own, and already have, which you learn from that, but
absolutely.
Don't just settle. If you feel like you need to make a change, get with a good counselor to give you the coping skills to do that, but don't feel stuck, I guess.
Yeah, for sure. I mean, I think that's one thing that's beautiful about your story is that, a lot of us are stuck in systems, whether it's family systems or marriages or situations where we feel abused, or we feel like this is just not where I need to be, and we're too scared to make adjustments. And so it's been cool to see you take, the risk and step out and do something that, the wave of people are doing this thing, and you're going, well, that's fine, but I got to try this. And I think we're seeing that more in general in medicine, in counseling, is like things are changing, and, we got to do things differently.
Right. And I think, stepping outside the box, and every year I would go to these direct primary care conferences, and it would grow the number of doctors there. And so, it's definitely a movement, and I think as we make the system easier to transition into, we'll see more doctors coming that way. And
yeah, about that. So for a person who's listening and this all sounds great, and they're like, man, it'd be great to have a doctor I don't have to wait in line with, and then, I can pay a monthly fee and all these kind of things. Who's your ideal patient? And then, like, how would somebody transition? Let's say they're paying $900 a month for Blue Cross Blue Shield, and like, how do you still pay that? Like, how do you still pay that and then comes to you? Like, what? Work me through that.
Sure.
'Cause I have people ask me about this all the time.
Okay. So, there's a couple of different groups that you kind of look at. So one, for me, the uninsured, so someone that doesn't have insurance and just feels that it's cost prohibitive, they're not able to afford it, there's no way around it. I think it makes complete sense. So
absolutely.
I cannot provide all the care you need, but I can provide a large majority of it. And so paying that flat monthly fee for primary care, which...
And what is that?
It's $130 a month.
Okay.
Which encompasses 80% of your care.
Right.
I think that's an easy sell of, hey, I get great care, a flat, transparent pricing, so I know what I'm going to pay. And then I also, I have a lot of resources, so I know how to get mammograms very reasonable. I know how to get pap smears, so you don't have to feel like you have to forego a lot of these screening tests, prostate cancer screening, basic colon cancer screenings, vaccines, just how to get a lot of this stuff without having to have full insurance. Now, I don't recommend anyone not have insurance, but if you're not able to, this is a great middle ground. Then that next group is those that have that do have insurance, but they have very high deductible plans. That group can benefit from this because we're able to reduce your out-of-pocket expenses. So, if you have a $8,000 or $10,000 deductible for the year, you're paying for all your care pretty much all year.
Yeah.
Unless something major happens, which for most individuals that doesn't. So your catastrophic plan is sitting there, but you utilize this for the nuts and bolts of your care throughout the year. Prevention, coughs, colds, congestion, illnesses that come up and that sort of thing. I spend a lot of time on wellness and nutrition, and I know we'll get into that, but so just able to reduce the costs for a lot of that care that you would be paying out of pocket every time you went to the doctor. You'd have to pay for the visit and testing, and a strep test can be, a lot of money, and it's covered in the monthly fee and the shot for the treatment, and that sort of thing. So as far as the actual plans, that gets a little more dicey because you got to go through an insurance broker, and they really know the nuts and bolts of all those plans. But more and more catastrophic plans are coming out. So used to that, I remember whenever I got out of college, I paid $100 and had a simple catastrophic plan. And then as more and more stuff had to be covered, a lot of those plans went away. And so you pay a really high premium for all these services that you may not need. A lot of those catastrophic plans are starting to come about. So I would just get with a good insurance broker to see, okay, what are my needs? Do I really need coverage for everything that's included in these plans, or can I raise my deductible? And then you add the direct primary care plan to it. So lower your monthly costs, add this plan in, you're covered for the catastrophic things that may happen, and then your nuts and bolts, your typical primary care is all covered by the direct primary care membership. And for some people it may not work. If they have a employer-based plan and it covers everything really well and they don't pay much out of pocket and they have low copays and a low deductible and they're happy with their doctor, then it may not be the right fit for them.
Yeah.
But, and then there's that third group that they do have those good plans, or they have Medicare that covers a lot of things, but they like the personal aspect, the more time with your physician. So, not feeling like you're rushed in and out. And
Absolutely.
So it's the convenience, the time you get with the physician that is, for them,
the most value.
So.
Absolutely. Yeah, and there's a lot of people out there. I mean, I know in our own experience, and we can, get into this in general, but, when you have, I guess the thing is that most of this too is based on years and years of kind of the norm. And I feel like in the last 10 to 15 to 20 years, based on, let's say, the way we prescribe antibiotics when you go to the doctor, based on the way you get treated when you go to, it's our own fault, and then it's the system's fault. And I think Dr. McMullen and I talked about this on another podcast, but it's like you go to the doctor and they give you antibiotics for everything.
Yeah.
And no matter what, it's like, well, here's a Z-Pack, because you have a cold or whatever, and you're happy to get it because you're like, I just want to feel better, so I'll take this. And I mean, I've grown up like that my whole life. Every time we went to the doctor getting something. Well, we're seeing now that there's consequences for that in our genes and in our mutations and food allergies and
microbiome and
gut health and all this stuff. And so it's like we're not the same people 20 years later that we were, and much less 40 years later than we were 40 years ago, eating grass-fed things, eating from the farm, eating from local, places. I mean, that's not been a long process.
Absolutely.
For thousands of years, you only ate cows that were around you. You only ate chickens that were down the street. You only ate food from the garden, and then the last 30, 40 years, now we're eating things from other countries that have. So my point is that when you go to the doctor, I feel like med school hasn't changed that much, is what it, it hasn't. I'm not saying it hasn't changed. I'm not hating. I'm just saying
adapted as quickly as our culture and
that's what I
environment
mean.
has.
Yeah. And same thing with psychology. I'm not hating on. I mean, I think it's all the systems. It takes a lot longer for a grad school and a system to go, okay, we need to rework this and change this and get some new things in, because everybody's kind of ground level. And so my point is that I think when we went with Grady to the doctor, and God bless all the doctors we work with, but sometimes it was like you can feel like you've had to study and research more than the doctor has, because they don't know what FPAS is, or they don't know what these things are. And my point to that is that I think there are a lot more people with sensory issues, with gut health issues, with allergies, with these things than there used to be.
Absolutely.
But the range is still like, well, we have 40 clients and you're probably this average person, so it's probably this. And that might have worked, and you might not have missed it very often 20 years ago.
Right.
But now, because of everybody's issues and because of the way our culture and our bodies are, I think there needs to be more of a narrow focus and more time, because we're worse. Right. Does that make sense?
Oh, absolutely. I mean, I say that all the time.
And yet we're just getting busier.
Yes, I say that all the time. Like, our culture, our environment, our toxic food planet has adapted and changed way more quickly than we've been able to adapt to it, obviously. And so I think the one big problem with that is we have to go out and educate ourselves.
Yes.
And so we didn't learn it in med school, and so now it's spending the time and the money of learning a lot of these new things that are coming out, and it just takes an exorbitant amount of time to do that.
Yes. I'm with you. I mean,
yes.
I tell this all the time about trauma. It's like, we all need to be getting EMDR trained and trauma trained. It's like, but I understand, not everybody can do that.
Right. And so I think, also at the same time, the system that they're in, it's the time factor. And it's not that they want to, I mean, they're all doing it from a great place from their heart, but it's the time factor of, hey, I've got all these things I've got to take care of. I've got to make all the right click boxes, and then I've got 5 minutes with you to talk about X, Y, and Z, and then we get your prevention, and so it's, how do I get all this done in this 5 to 7 minutes of this visit? And it's impossible.
Yeah, it really is.
And so there are a lot of things that get left out, and we do a lot of times, what is the quickest solution that's going to make you feel better and get you better, but it may not always be the optimal the way to do it.
Right.
And I think it falls on both sides. I mean, it falls on the doctors making the right decisions and not just doing what is expected from the patient, and then also from the patient not, expecting something when they go to the doctor, being willing to say, hey, give this a little time to let your body heal on its own, and here are some things to do. So I think it's hard on both sides to...
Yeah, you're right. It is both sides. Because then you have the whole malpractice insurance part, where it's like doctors are doing the best they can with what they have, but then they get sued for stuff that's not really their fault. It's the client, it's responsibility, and it's just this big mess. So now we're like a lot of things we're like just avoiding getting sued.
Yeah, and overly ordering things that are maybe unnecessary. Yeah. It's a complicated web.
It is. So I think that's what's beautiful about what you're doing is that all the systems are important, but sometimes the option, the choice for any of us is like change the system.
Yeah.
Do your own system, and I love that that's what you're doing.
Yeah, and I think with in that we're talking about antibiotics or colds. In that case, it's like, hey, this, based on what you're telling me, this does not need an antibiotic in 2 or 3 days. Let's check back in, and if the symptoms aren't improved, we can do X, or X, Y, or Z. But whereas in a traditional clinic, it's like, hey, I'm gonna have to pay that another copay or another to go back. So you don't want the patient to have to do that and take off work again, and
yeah, they're not gonna just email you and be like, you good?
Right. So it's the system that you're in. It's like, okay, if you're not better in 2 days, here, take this.
Yeah.
So,
it's like one more day, you probably would have been better.
Yeah.
I mean, I found that a lot with steroid shots, and it's like we had COVID over Christmas, and I remember I was about to leave, and the nurse came in, and she was like, "Well, we were sending you home with a Z-Pack, and then we're going to give you a steroid shot." And I was like, "For what?" And she's like, "Well, just in case." And I'm like, in case what? And she's like, "Well, you could have a bacterial infection in your lungs." And I'm like, "You said my lungs were clear." So we had this like back and forth. I'm like, "No, I'm good." Yeah. But it's just this weird, people want something, people want to give something, people want to cover it just in case they didn't. They're not going to see him again forever because I went to, like a quick care.
Quick care, yeah.
And so it's just crazy.
And I think that's where, kind of on the same level as what you do, like that's where the relationship comes in.
Yes.
And knowing the person, and I know the last time this happened, I know exactly what the course was like, and, I know how they respond to this medication, and I know, so getting to know them on a personal level, you get to know their resiliency and what they can handle, what they can't, and can, I feel, take a little more personalized approach. Yeah,
because that's what so much of doctoring was in the beginning. It was just meeting people, getting to know them, care, going to their house and sitting by them and talking to them, and not a whole lot of medicine going on before we had a lot of this stuff.
Right.
And I think we've lost that piece and gained a lot of the other stuff. And
yeah, and I think it's going to take just kind of one doctor at a time, making the change, and too, on the patient side of maybe having a little bit different expectation when you go in, and how can you change your mindset and make the relationship work better. And
yeah, because I would say on your end, when you're one of those people who know you're going in for 7 minutes, like have your stuff together. Maybe know your history, know your stuff, be able to go in and present it to your doctor well.
Oh, absolutely. I mean, if that's one piece of advice I could give is, yes, and maybe whether it's a notebook or what, have your information for you, very handy, because whether it's patients coming in, well, what medicines are you on? Well, I don't know, or I'm not sure, I was given this, but I'm not, that was a long time ago, I don't know if I'm still on it, or I may have had that vaccine, but I'm not sure. And, yes, we can go out, and some of that stuff we can find, but I may send a record release request 3 or 4 times before it's just not an efficient system.
Yeah.
So the best way to know that you're going to get the care you need and your records are going to be right is for you to stay on top of it as well, and know when you had a procedure, know when you had a certain vaccine, hey, I just had labs done, because a lot of stuff we duplicate. I just had labs done, 3 weeks ago at this doctor's office. We don't need to repeat everything that we just ordered. But unfortunately, all our electronic health records are on different systems, and none of them talk. And
again, and that's the problem with technology, is we lose the relationship piece.
Yeah.
We get so reliant on these systems that actually don't end up communicating, because there's 100 of them and nobody's using the same thing.
Right.
So it's like it kind of kills the point in general.
Yeah, absolutely. And so, the systems that were supposed to make everything so efficient have done the opposite effect.
Yeah. Yeah, and then the people are getting lost in the mix. And it's the same thing with insurance with mental health and insurance with other things. It's, we have people who take insurance. I'm getting paneled for a couple things just to help some clients out, but it's like it's not necessary, because the headache of filling out the paperwork, turning it in, doing notes, that's time away from your patients, the time away from your clients, time away from your family, or you see less people.
Right.
And so it's like, so that would be my advice for people if they're going to a doctor is, even though, yes, the systems are difficult and, we're all in this together. And so trying to have that mentality of like, if I'm going to stay with a doctor who sees 40 people a day for 7 minutes, I need to go prepared and not be expecting them to be able to do all this kind of stuff.
Yeah, and I would say even for the model I have, it's still good for you.
Well, yeah.
Yes, for you to know what's going on with your health, and I think that's huge in what you do too. It's like, how do we empower people to take personal responsibility?
Yes.
For their care. Yes, we're giving you the tools that you need. I'm here to help you, but you will not find health in my office.
Yeah. Well, I think it's easier. Again, the overarching theme is it's easier, in my opinion, in your model sometimes because you're able to have time with the person. So they feel safe, they feel seen, they feel heard, which then empowers them to take responsibility.
Absolutely.
But when they go in and they feel like they're a product and they're getting ran through the ringer, then they're already triggered, they're already overwhelmed, and then they lose all of their self in that. And then they leave going, what did the doctor say? What was I supposed to do? Am I taking this?
Right.
Oh, I need to get this prescription. Oh, well, they called the wrong thing in, or they don't have it, or it's at the wrong Walgreens. I mean, we've all been there.
Absolutely. And that still happens.
Oh, it's infuriating. Yeah.
That's impossible to completely correct. But yes, we try to work through some of that. But faxing and getting the medicines to where they need to be can be a big challenge.
Oh, yeah, for sure. Okay, so let's talk about, you wanted to talk about kind of nutrition and chronic disease prevention. And so that's the other part of what you're doing is instead of always treating symptoms, right, instead of saying, hey, it's a mess, come in, we'll give you some antibiotics. But tell me about kind of your view of treating symptom or treating prevention instead of treating symptoms.
Sure. So, I mean, I think first kind of getting everyone to understand what chronic disease is. So if you think back in the 1900s and the early beginnings of medicine, it's like what used to kill us or harm us was infections. Mm-hmm. And so there wasn't, and we died way younger, and so there wasn't all this time to develop all these chronic illnesses. And so we would either get over the infection or die. And then, of course, antibiotics and all these fabulous inventions and things like that started to make infections not be the leading cause of death. And so now kind of what is taking over as our culture, our food environment, and all this is so rapidly changing are chronic illnesses. So things that don't necessarily go away unless you really work at it. Conditions lasting longer than a year that are lifelong. Things like heart disease, high blood pressure, diabetes, cancer, dementia, COPD, all these big name conditions that for the most part they don't go away. Mm-hmm. And so that is the next pandemic or epidemic that we're experiencing around the world. It's not just America, is the rise in chronic illness.
Yeah.
And the amount of our healthcare dollars, of our $4 trillion a year healthcare dollars, like it's estimated maybe 80 to 90% of that is on chronic illness care.
Wow.
So it is a huge burden, whether we realize it or not.
Yeah.
And then most people are not affected by just one chronic illness. It's, 1, 2, 3 things they have going on. And so I think the shift in what we're treating has drastically changed. Not necessarily since I started, but, from 50, 60, 70 years ago.
Right, which in human history is not that long.
Right.
Yeah.
And, which we'll talk about a little bit later, seeing it younger and younger and younger and younger.
Yeah.
So it's no longer, odd to see a adolescent with type 2 diabetes, where it used to be unheard of. So
right. Why do you think that is? I mean, we can get into that now.
Yeah, I mean, I think it's so many different things, but I think it's our food environment, and that's why I play such a big, put a big emphasis on nutrition. You are what you eat, and that's so true.
Oh, yeah.
And then you are what you ate.
Yeah.
Which is a whole nother talk, I think. But so, looking at food as fuel for our bodies and how do we adapt to this changing environment, I think has been is such a huge challenge. And it's the hardest thing. The hardest thing that I do in my clinic is to get people to change their eating.
Yeah, because people can literally be dying. Mm-hmm. I mean, I have family members, clients, and you're like, hey, you're dying because of this. You need to lose this much weight or you're going to have another stroke or heart attack or whatever. And they just don't do it.
Yeah.
I mean, they do it for a little bit. Right.
And I think you don't want to say it's an insurmountable challenge because it's not.
No, definitely not.
Not. But, we all know that broccoli is healthier than M&Ms, but it's how do you get somebody to make those different choices? And a lot of it is education. I mean, a lot of people just don't realize.
Oh, for sure.
Do not realize the amount of sugar that is in food and, what they're eating. We are so busy and so on the go that we are just, aimlessly.
Yeah. Well, I think part of it's we trust the systems too much.
Yeah.
We just assume nobody's trying to kill us. You know what I mean? Right. It's no, they literally don't care. They're just boxing up things with 75 ingredients on it to make money.
Right.
And to keep costs down and to make it cheap and,
And slapping health labels on.
Oh, yeah, for sure.
That's the hardest part to overcome. I mean, it says heart healthy or it says lower your cholesterol and, so it's hard to know.
Yeah, what is it? When something has vegan free on it, or not vegan free,
gluten free.
Gluten free, and it's meat. It's beef jerky. It's it doesn't have gluten. It never did. But they throw. Yeah, right. Exactly. But that's the problem. Yeah. I mean, with us having food allergies, again, it's I've learned over 6 years with Grady to so much about that stuff because I'm why does this have dairy in it? Or why does this have corn in it? Or why does this have, this extra stuff in it? And it's so frustrating because he's allergic to these things and it's so unnecessary for it to be in there. But you're trying to find the one box of whatever that doesn't have it.
Yeah. Yeah.
And you start realizing, all that stuff that's in there.
Yeah.
Red 40 and, it's these things are terrible. And then once because we have this kid who doesn't have it, when you introduce it to him and he has something with like Skittles or, he can have now, I watch his behavior and his sensory issues and his irritation and
yeah.
And I'm oh, what did he eat? Oh, he ate Skittles this morning. And it's it literally, because I'm watching it, drastically makes a difference.
Yeah, absolutely.
And yet, if you don't have those issues, you're just always eating it and doing it. So you don't even see that is actually the thing causing some of the outlier issues.
Right, and I think that's sometimes the eye-opening moment for people when you do start to tease that out. And I do it myself. I mean, we play tricks on ourselves. We think, I have so many people, okay, oh yeah, I eat healthy. Oh yeah, I don't drink sugar or I don't have much caffeine. And it's okay, well, let's get into this and let's talk about what you're eating for X, Y, and Z. And then you start to say, okay, let's look this up, and I'll look it up on my computer and holy cow, I didn't know it had that much sugar in it, or
Absolutely.
And so.
Well, you're also moving from train wreck, I'm gonna die before I'm 70, to I'm doing pretty good, to I'm being healthy, and so a lot of times we move from train wreck to I'm doing pretty good, so yeah, I'm eating good, and it's well, yeah, what are you comparing it to? Are you comparing it to ideal, what your best option, or are you comparing it to horrible things?
Yeah. Well, and I think too, what's encouraging, especially with a lot of the data, is it doesn't take perfection.
No, for sure.
To make huge changes. It can be a 5% weight loss can make a huge reduction in your risk for diabetes and things like that. So, yeah, I mean, it's definitely not perfection we're seeking. We're seeking progress. And I laugh because, I'll talk to different people that know a lot about nutrition, and they're like, well, give them this recipe for salad dressing. I make my own salad. And I'm like, look, they're drinking a 12-pack of Sunkist a week. I've got I'm way off from them making their own salad dressing, so you meet people where they're at.
Absolutely.
And, find out what are the barriers. I have a lot of truck drivers like, okay, you're doing this because you're on the road and there's nothing at gas stations that's healthy. So how do we kind of fit this into your lifestyle where you can make small changes and start to build on that you can see, get confidence in and see how easy it can be.
Yeah. Well, that's the thing. And that's the beauty of what you do is that, and I mean, with Ashley and Rachel, our dietitians, and is that being able to sit somebody down and say, tell me your context, tell me your life, right? Because that's so important. But just saying what to do doesn't really work.
Right.
Because so many people have different variables and reasons for why they do it, right? I mean, the reason we're doing this podcast is the idea of asking those good questions, like asking why it is that you're drinking 12 Sunkist a week, like not everybody's going to do that. Of course, the person knows they should, it's not good for them to be doing it, but you're going to have to get into their context to help them understand. And as a doctor in your clinic, meeting one-on-one and having time, you can do that.
Absolutely.
And then you can call me and say, hey, you're seeing this, you're seeing this client. I know they're struggling with anxiety. We talked this week about, them drinking 12 Sunkist a week and how that sugar and that caffeine and those things are going to jack them up.
Right. And I get into, so what vegetables do you like? And I mean, we can showing them pictures of food prep and really getting more personalized with our advice and how do we overcome these barriers? Because I mean, and the two biggest barriers are time and money, to not eating better. And I get that. And so we've got to talk about, and I struggle with it myself. I don't eat perfect.
For sure.
And, busy and all that. So really sitting down with somebody, how can we prep? What are some good choices? How can you save money? Oh, did you know this week, this was on sale here? So it's just a personalized way of getting down to the nuts and bolts of their eating patterns and why they make the choices they do, and how can we over six. I say all the time, I don't care what you're eating next week. I'm looking at the long game here.
Yeah, the big picture.
I want to set some new foundational habits. So in 6 months, in a year, in 2 years, we're continuing on this path. We deviate off, at a birthday party or, whatever. And then we come back on our path, and our bulk of our 80% of our diet is the healthy foundation that we've made over time.
That's so good. Yeah. I say that all the time about parenting, marriage. Like, you do not have to be perfect. Just do the right thing, 7 or 8 out of 10 times.
Yeah.
If you're yelling at your kid and you're struggling with anger and frustration, like, okay, you're going to yell at them. Sometimes you're going to get frustrated. So don't put a high expectation you can't meet. Right? Same thing with diet culture, right?
Absolutely.
Like, I'm never eating dairy, or I'm never eating cake, or I'm never eating dessert, or I'll never drink a Coke, or whatever. Like, well, you're certainly going to do that. So then you feel shame and you feel failure. And then you just go and you're like, well, I can't do it perfectly, so I won't do it at all.
Right. And I think the same thing with children. Our bodies are very resilient.
Yeah, for sure.
They can take a lot of beating. And so, messing up here or there is not going to, ruin everything. So it's getting back on that path and
absolutely,
and moving forward from there. And I think, the simple advice would be, I love Michael Pollan. He's an author, and he has literally the simplest, best advice I can ever give anybody is eat food, mostly plants, not too much. Mm-hmm. And, that first one sounds simple, eat food. Okay, well, something with 5 ingredients on the label is actually not food.
Yeah.
So it sounds simple at the beginning, but as you start looking at things, an avocado, an egg, salmon, arugula, cabbage, all these are real things, whereas you start getting into the processed, boxed, pre-made, pre-packaged, pre-bottled.
Yep.
That's when you start to veer off from what's really food.
Absolutely. And if we extrapolate that out, you have to go, well, why do we do that? Convenience, money. Okay, well, what's our lifestyle? Like, because we're dying. We're dying on, well, I can't afford it, or it's I'm too busy. Yeah. Well, I'm too busy trying to work to make money to provide, to buy this boxed lunch that's killing me.
Absolutely, yeah.
And so for a lot of us, it's just learning to take the time to slow down, to be in relationship with somebody, a doctor, therapist, dietitian, chiropractor, whoever. And just take a breath and realize, like, I'm moving way too fast. Things are way out of hand, and I need to reassess how I'm doing this.
Yeah, and it's about changing your priorities.
Yeah, well, and asking those questions. I mean, we've had this conversation. I've had it with all of us, that work together. It's like, okay, I'm getting stressed about this. Well, is that really what we think? Is that really what we're striving for? Well, no. Well, then we're not going to be happy. If making $60,000 pays all your bills and puts money in the bank and you're happy, great. But you're going to overwork for $70,000 this year?
Yeah.
And we, I think a lot of times we get caught in that performance-based cycle. And it's like, but that all plays a part into what we buy and what we eat. Mm-hmm. We just don't stop long enough to look at how those momentary things are causing huge problems long term.
Absolutely. And they say choose your heart or choose now what you're going to spend time on. Yes, absolutely. It may cost a little bit more to eat healthy. It doesn't always have to, but it can. But medications and doctor visits and all this stuff is very, can be very expensive. So
not to mention, like, when people say that, it's like, well, how much money do you spend on alcohol and cigarettes and going out and movies and NFL Network? And you know what I mean? I mean, it's a priority issue. And I'm not calling people out. I'm saying I have to check the same things.
Me too. I mean, I told my husband many months ago, I really want to change our food budget because I feel like I need to be buying better stuff. I could be spending more on food, and we're not. So so we're constantly looking at that as well. I mean, it's not just.
No, it's ridiculous. We went last night. I got off work, worked all day. Called JC. She's like, "Oh, I'm sorry, I didn't cook anything." I'm like, "You want pizza or El Cabo?" That's the two options I got. And I got El Cabo. It was like $60, and I'm like, "Good Lord!" Like, I can't be paying for this, every week. Right. But before you know it, life is busy. And then you look at the last month and you're like, we ate out way too much. Mm-hmm. You spent way too much money. And it's like, well, do the math. You're going to compromise something next month because you did that.
Right.
And so again, it's not this idea of being perfect. Like, people talk about, like, basically you need to have a balanced life. Mm. Be balanced. And it's like, well, no, you strive for balance. You're never going to hit balance. Right. You have to you just have to play the game of, finding balance in our lives of food and money and time and energy and work and family and church and. Yeah,
and I think it's constantly reevaluating that. And my sister-in-law told me she was in town for Easter, and I was telling her this, and she was like, "You're like way busy." And I was like, I've been thinking that lately, and I've told this person I need to hold on that, and so even if you have overcommitted, you can always scale back. And,
absolutely.
And you start to realize, wow, I didn't have as much time as I thought, or I shouldn't have committed to this, and so say no, or delegating tasks when somebody else could be doing them more efficiently, and the balance is a constant. It's never going to, like you say, it's never going to be, okay, I'm balanced and finished.
Yeah, for sure. Well, I think what happens, though, is that we feel ashamed that we're not, and that because we have some unbalance in our life that we're wrong and bad and we should be doing it better. Right. Instead of being in communities and relationships where we're all kind of working that with each other, and it's okay to have a week that's struggle, and it's okay to slip up. And, I have those days where I've said, I left myself, it happened a couple Fridays ago. It's like I left myself 2 or 3 hours to get some stuff done. Had a client text, "Hey, I'm struggling with this." I was like, "Okay, I'll see you." And then somebody texts, and I'm like, "Well, I guess I can go to lunch at 1. And then I'm like, "Oh man, I forgot I had a meeting." And then I really didn't get a break all day.
Right.
It was all good intentioned. Clients got helped, but I ended up on a Friday being just like, I'm zonked, and instead of being like, what an idiot, like, can't believe I did that. I had to go, okay, what do I do next week to make sure that doesn't happen?
Yeah. And, we've talked a lot about boundaries.
For sure.
And still working with that. I've never been good with boundaries. And so I think that was another big issue at my old position, is not having healthy boundaries. And so just feeling just constantly just keep giving. And so you have to slowly build confidence with that as you set healthy boundaries and see that things don't fall apart and that patient, or person doesn't hate you.
It's fine. Yeah. Yeah. That's, man, I learned that lesson. It was when Grady was at St. Paul's. So he's my oldest, so he was 2 or 3, and it was like, I don't even remember what happened, but I'm like, I want to be at everything, you know, every school event, everything. And it was like a Thursday, they had like a Halloween thing, and I didn't know about it, or JC had mentioned it, but I didn't put it on the calendar. And so I didn't go. And she was like, you know, Grady was looking for you. I mean, she didn't care, and she didn't, you know, even remind me. But I was like, never again, you know. But in my head, I was like, well, I had this scheduled already. And now, I mean, I'll just text a client or call and say, hey, look, my kid has this on Thursday. I know we normally meet, but I'm not going to do that, you know. And they're like, yeah, great, go see your kid, you know. But if you're stressed out and worried and overwhelmed, then you're going, they're not going to like me. They're never going to come back. They're going to be offended.
Right.
And good boundaries go, hey, that's their stuff and not my stuff. You know, I got to be able to say, you know, the best yeses, and I have to be able to say no.
Yeah, and that is so hard, especially if you're not used to it or practiced at it. And
oh yeah, it's a lesson you have to learn, and you bump your head.
Yeah, for sure.
So when you were talking about kind of chronic disease stuff, what was interesting to me when we were talking, we didn't talk about this before, but you know, you said COPD, heart disease, early death, you know, dementia. Well, those are all the list of things from ACEs scores, so adverse childhood effects, right? So that's all, or experiences, adverse childhood experiences scale. So the ACEs score, right? For people listening who haven't listened to the podcast before, these are things that happen to you early in your childhood that are emotional, physical abuse, sexual abuse, divorce in the home, mental illness in the home, battered mother, incarceration. So if you experience any of these in childhood, the more you've experienced, the more likely you are to have COPD, heart disease, chronic illness, you know, early death, suicide, depression, anxiety. So it's interesting to me from a mental health standpoint. I mean, this is why we're working together.
Yeah, I mean, this is exactly why these two fields go so well together.
Yeah, it's so crazy. Like, I mean, I know we're doing it for that reason, but even as we're talking about it, I'm like, oh yeah, because you can't really separate out the mental health aspect. I mean, for me, I'm biased. I think that's the core. I think equally so, what we eat, what we drink, our bodies, our epigenetics, all those things are out of play. But I mean, they're probably on the same hand. But I think people were a lot more used to going to the doctor than they were going to therapy. And so my point is that tell me about how, I think that's why you're passionate about mental health, so I'll shut up. Tell me why, you know, mental health is such a important part for you to integrate into your practice and what you're doing.
Yeah, absolutely. So I'll start with that point is, you know, we learn all these systems and these, you know, ear, nose, and throat and lungs and heart, and that sometimes I think we forget to look at the whole picture. And so I'm starting my practice off and seeing people, and then I'm just like, why are some people getting better and why some never get better? And, you know, they end up doing way worse with this condition than I thought they should, or they're never doing what I ask them to do when they come back, and over time, you know, I don't know why, it just clicked. Oh, it's all these things you just mentioned. It's the social aspect. It's the mental health aspect. It's their resiliency, their coping skills. I'm not dealing with any of that. You know, and you know, I can't say I wasn't taught that. It just wasn't.
You didn't get it.
Yeah, it either didn't click or it just wasn't a huge part of all that. It's like they have X, Y, and Z. They have these 3 symptoms. How do we fix that? And tests and textbooks are not real life. And so I think it took me a while to slowly realize that was the missing link. I've got to deal better with their mental health, their social, and now I have the time to do that, because before you didn't even want to dig.
Yeah.
You've talked about this. You didn't even want to get into it because you don't have the time or the resources to help them with it. And
you're like, I'm not touching that.
Yeah. So, you know, yes, my son has an opioid addiction and I have to go take care of his son and bring him to visits, you know, every week. But that's why I didn't get my medication filled. And so I think that's one aspect of it, is the ACEs score, and your mental health has just a huge impact on your physical health. And then at the same time, you know, I've been greatly impacted by mental health too. So my father was bipolar and he committed suicide when I was 10. So that, you know, just hit me in the face at 10 years old of, you know, this innocence is taken away, and you no longer see the world through the same lens. And mental health was such a huge aspect growing up. And then I've also struggled myself with anxiety and depression. It's a chronic lifelong illness too, so off and on. And so I think having that history and a huge empathy for what people are going through, combined with the huge impact it has on your physical health, it just kind of naturally makes sense that that's going to be a big part of what I focus on and talk about and try to heal and help too. So
absolutely. Yeah, I mean, when you've gone through it, right, you see it so much more clearly in other people, and you realize, like, and I think the biggest takeaway for people on this episode and just in general and listen to us ever talk is that's everybody.
Right.
You know, I hate that we live in this this culture where we see a symptom or we see a behavior or we see heart disease, and we kind of shame people and assume, oh, well, they must have done something wrong. It's almost like Job in the Bible, where Job's suffering and he's got all this stuff going on. His friends come up and they're like, well, what'd you do? You know what I mean?
Yeah.
And yes, we have personal responsibility. We've made bad choices, but generally those choices didn't start out as an adult. You know, the guy, you know, it's like I work with sex addiction a lot, or alcohol or whatever. And it's like, we didn't have a great life. And then at 35, you're like, I'm going to cheat on my wife. Right? It's like you didn't have
layers.
You didn't have a great life, and then you have heart disease. Like, it's all linked to ignorance and not knowing and no education and trauma and early childhood issues. And I think if we could have the time to be humans and to be in a relationship with each other and to see each other contextually, then we could solve a lot of our problems individually.
Yeah.
You know, in relationship, and figure things out. I think that's what's so beautiful about what you're doing, and what we're trying to do as a practice is going, send us your people who are hurting, who are broken, and we're going to walk with them and figure that out intricately based on their context and what they present with and give us. You know, but it's taking all that into consideration.
Right, and that's what I love, being able to come here on Mondays and hear y'all's, you know, because can't know everything.
No,
so,
for sure.
you know, taking all y'all's wisdom and guidance on that aspect too, and learning about trauma, and so I can better incorporate that into my practice. I'm not going to fix all these issues, but I can guide them into the resources that can, and get them to the people who can help them with that, and then have that understanding and knowledge of how do I better help them for my on their blood pressure and their cholesterol and all those nuts and bolts things.
Yeah. Well, it's assuming, right? I mean, assuming in a good way. You know, there's that joke about what assuming does, but you know, the reality is that when you're a doctor or you're a therapist, and really just in general, you know, one of the parts of trauma informed care, which I'm going to change to trauma responsive care, is this idea of assuming that people are hurting, not behaving towards them negatively or like they're a victim or they're a problem, but just being sensitive to people coming in our offices going, they probably had look at the world, right? I mean, look at where we're at. They probably had a hard day. They probably got something in their life going on that's stressful. They might have some anxiety or depression, unless they're the random tiny percentage of people who don't have any of those things. But most likely they do.
Yeah.
So what's my posture, and how could it be towards them so that they feel heard and seen and known, and because they're going to give me better information. You know, they're going to be more open to me and be more honest with me if they feel safe.
Absolutely. And then in turn take better care of themselves once they're open and feel
Yes.
safe and can learn. And
yeah, because we felt so much shame, you know, and all kinds of, you know, me personally, but also just millions of clients that I've talked to, like, you're sick or you get COVID. I mean, I think that's one of the hardest things about COVID right now is like the shame that goes. I mean, we got COVID in December, and you feel this like you're dirty, you know, like you're bad and you're shame, you know, you got everybody else sick or you have the potential to, and it's like, man, it's a freaking disease that nobody can help getting, like, you know what I mean? Like,
right.
But there's all these layers. And so then when you're feeling like that, you don't want to go to the doctor, and, you know, then you want to go to the doctor and check. It's just a mess.
Yeah, it is. And so I think kind of the integrative looking at the whole and putting all these pieces together for each individual patient can make them feel safe. And I've had lots of patients come from you guys saying, you know, they referred me here and they said that, you know, it's a small clinic and my information's going to be safe and you understand what is going on with me, you know. So I think it definitely helps most individuals to feel that you care on a deeper level rather than just what their blood pressure is.
Yeah, for sure. I mean, like, we talked to Dr. Jenna about that, and it's like, when you're going to chiropractic and you've been in a wreck, let's say, or you hurt yourself because you fell, for her to be like, man, I bet it's tough that you can't lift your kid this week, or that your husband's having to bear the burden of that. Or, it's little caveats like that by just being informed of systemic kind of views that allow the person to be like, oh my gosh, like, I've been to 15 other doctors that never said that.
Right, and I've had to learn that. Like,
No,
it wasn't
sure.
something that just happened naturally, and taking guidance from y'all on how to, because you are a little bit scared, like we said before, to kind of get into some of that, because then you don't want it to
turn into a therapy session.
Right.
Yeah, for sure.
And so, yes, learning how a little can go a long way, and it doesn't have to be,
sure.
Sit down and tell me all about everything. And that's the beauty of each time I see a patient, I have so much more time with them that I learn a little bit more and can ask a few more questions. It doesn't have to all be in that first visit. So.
Yeah, and even if you got it all, you wouldn't be able to fix it anyway, then.
Right.
That's what I tell our new therapists or therapists in general. Like, yeah, when a client comes in 2 or 3 sessions, if you're trained and you generally know what the problem is and could just tell them, but they might not figure that out for a year or 3 years.
Yeah.
And the part of the process is knowing and letting them walk through that and be patient with them and get to know them and really them to get to know themselves. Because even in your field, it's like they're really just telling you their story.
Mm-hmm. Yeah, that's the joke, or not joke, but they used to tell us all the time, like, just listen to the patient. They'll tell you what's wrong.
For sure. And they will, because we're the experts on our own life most of the time. We just have so many blinders put up and so much fear and insecurity and shame that we don't know how to be honest.
Yeah. And I think the fear for me in the past has been, as doctors, you want to fix everything.
Yep.
And so, man, if I ask all these questions and I don't fix it, then you feel somehow insecure or like you haven't done a good job, but you can't look at it that way.
No, you can't. Yeah, I have a couple clients, we joke all the time because they're like, well, you earned your money today or whatever, or they're like, tell me something, I'm here, I'm paying you, tell me what to do. And I'm like, I'm not here to tell you what to do. It's not, tell me about that, like, why does it, and that works out, right? And it's not that people actually want the answer, because they're not going to do it anyway, if that's the only reason, right? Because we could tell people what to do every day.
Right.
It goes back to the vegetables. It's like, hey, you had a heart attack, you need to stop eating this. And it's like, yeah, but I like that. And then you get into the social, cultural, like, my family eats this, and we have this every year at this, and
yes, for sure. And I think, commenting on what you said before, trying to use and learning more about motivational interviewing and different techniques to get them to come up with the plan more often than me, because they don't end up doing it when I tell them what to do. So, okay, what do you like to do? You like to garden, or you like to dance, or, okay, let's make that the prescription and not go to the gym twice a week or whatever it may be.
No, for sure.
But then what was the last thing you said? I forget what you had said something. Oh, cultural and...
Oh, yeah.
Absolutely. Huge barriers there. And so that's why I always try to tell patients, please try to get your family on board with this. Because if you're doing it in isolation, it's never going to work, whether it's quitting smoking or changing your diet or stress reduction techniques or whatever it may be. Mm-hmm. If you're not doing it with your, whether it's your roommates or your, nuclear family or whoever it is that's closest to you, talk to them about it, get them on board. Very likely they need to make the same changes anyway.
Absolutely. Yeah, and will, begrudgingly. That's part of, again, working in therapy is getting people to learn how to set those boundaries, ask for what they need, have healthy communication with their partner or their spouse or their family, and say, hey, listen, like, I'm trying to quit drinking, and you guys drink and y'all are fine, but I drink way too much. Mm-hmm. So can you guys either not do that around me or, but then people don't want to do that.
Yeah. And a lot of times too, I think, I'll mention, well, have you talked to them about that? And they're like, well, no, I know how they're going to.
Exactly.
It's like, whoa, wait a minute. No, you've got to have that conversation. So they know how you're feeling, or they know what they're doing that's making it harder for you. And, but if you avoid that conversation, then of course it's never going to change.
Absolutely.
So,
That's good. okay, so we wanted to talk about, kind of prevention. So you're wanting to start with kids. Tell me a little bit about kind of, you're talking about doing some education, schools.
Yeah, so I mentioned wanting to get into the school system somehow. Now, this was pre-COVID whenever I had this idea. Yeah. So we'll see how that pans out starting next school year. But I feel like the burden is so huge that if we don't start when children are young, we're not going to move the needle much.
Yeah.
And so I've talked with Dr. Virginia too about this, and we have a lot of ideas. It's just getting it on paper and implementing it. But I would love to be able to go into schools, and whether it's multiple schools or, more recently I'm thinking maybe I should just stick with one school and see how much of an impact I can make in one school of laying down the foundation of that nutrition education. And, whether it's having the parents come, I don't know if that'll be possible, but, not feeding your kid juice when they're young in the bottle, and having kids grow their food. I know at my daughter's school they have a small garden, which is great, but not every school has that. So how can we show kids where their food comes from, and planting things and just getting them to have fun with it and
normalize it. Yep.
And
you
then
mean
hopefully
you shouldn't
teach
give your kid a sugar drink in the morning, and then when they go to and then give them Lucky Charms, and then when they get to school, them get a Pop-Tart, and then by 10 o'clock they're getting kicked out of the class because they're not paying attention.
Right.
I mean, that's the system. Like, I've had that with clients, and it's like this kid's ADHD, or he's got issues, or he doesn't listen, and just going, well, what did he eat?
Yeah.
He ate so much sugar, before 10 o'clock.
And not that it will fix that, but it will increase the chances of controlling it much better.
Well, if anything, you get to, again, you're ruling out things.
Yeah.
You're going, okay, here's the primary issue. My kid gets in trouble. Well, you have to check a bunch of things, and we got to get rid of this and this and this, and the drivers, so to speak, to that central issue. And no, they're not all gonna taking one drive away. It's not gonna take the middle thing away, but you start realizing like it's the pieces of the puzzle.
Absolutely, and so not only nutrition, but getting into, and we've talked at length about this, screens and social media and that aspect of how it plays into your mental health. And so trying to teach them early, like, how to use these in a healthy way, which is not always easy, and movement and just so many things. I think that if we can teach them early and get those brain connections going, then it's a lot easier than trying to change things when you're 50 or 60.
Oh, for sure. Yeah, I mean, you're right on line with my thinking with so many things. I mean, I've been doing trauma therapy for a good 7 years now, and then, therapy before that, and now doing the practice for 4 years. And I love doing the day-to-day work with adults. I love working and helping people, and I see people recover and do amazing things. But yeah, especially when you talk about technology and, social media and all those things. And just the saddest part is the 13 to 18-year-old kids right now, the triage that we're going to have to do in the next decade for them. The problem is, like, if you don't do what you're saying and I don't do what I'm trying to do, which is the early prevention, 0 to 8-year-old parents and kids, then we just swing this thing again another decade.
Yeah, and that's...
Because the 12 to 18-year-olds, we can help them, but we're going to help them recover. We're not really helping prevent anything. They're already 12 years into it, 18 years into an addiction or into impulse control or into whatever. We can help them recover from that and not have a whole 40 years of adulthood that's a mess. And I think that's what we're doing currently. But if we don't, as a culture, really push hard into the life of these parents and these families.
Yeah, and it's a big burden, you think, but you just have to, there's plenty of need in your community, so you don't have to look outside of, even if I just, I live in Mooringsport, tiny little Mooringsport, and so even if I just had an impact there, it doesn't have to, for anybody thinking of helping out or, helping at your church or whatever, it doesn't have to be this huge thing. I think we sometimes make it.
Well, we get overwhelmed. I mean, and I do. I mean, I look at the big picture and I know the details and the stats, and I'm like, uh-oh. But then I have to stop and go, we were talking about, again, to reference Job, I was telling a client this morning, we were talking about chapter 38 is when God comes forward and says, did you tell the stars, where to be in the sky? Did you stretch out the constellations? Did you tell the sea where to start? Like, he just goes on this tear, about how big and amazing and and then we can get overwhelmed with that in life and the problems and how big things are and even how big God is. Mm-hmm. But then chapter 39 starts with, did you watch the doe birth the fawn? And it's just this amazing thing of well, yes, God is huge and the problems are huge and the world's big. And yet God is saying, I'm intricately involved in the birth of a deer in the woods by itself. Mm-hmm. Right. And that goes back to Matthew of I clothe the lilies of the field. How much more will I clothe you? And I watch every sparrow. How much more will I love you? And we have to then just go, okay, well, then I just have to do my sphere of influence.
Right.
I just have to care for the person in front of me with the skills and the gifts that I have and influence that person. And that's all I'm required to do and responsible for. And if everybody would do that little bit,
yeah, it could make a huge impact.
Huge impact. We could swing this whole thing. So my challenge for people listening, is whatever you do, whether you're a doctor or a teacher or a therapist or, you work at Clico in the electrical department, I don't care what it is, you can make a huge impact by just doing a little. Mm. It's not a little, because that little impacts so much more than you could ever know. And ultimately, God is present in those tiny little details just as much as he is telling the stars in the sky where to go.
Absolutely. And even just as easy as a smile or kindness.
For sure. Gosh.
that seems to be in short supply.
Yeah. Well, that's another problem with the technology, right? Yeah. I mean, that people don't know how to have a conversation anymore.
Yeah. And it's funny you mentioned the Matthew verse. This is not completely off subject, but I was thinking a little bit of, making these huge changes, and it talks about, do I not, is it the sparrow or the bird does not reap, it does not sow, but it is well fed, is taken care of. And Dave Ramsey, I don't know if you, I'm a fan of Dave Ramsey, he said, yeah, but God doesn't take the worm and put it in the mouth either.
Absolutely. Yep.
So, yes, he is going to take care of us and give us what we need, but we also have to
take personal responsibility.
Put in the work and
for sure. Yeah, we have to do something.
Yeah.
It's through his effort and his power and his spirit that we do it. Mm. But yeah, we have to I think the thing we have to do is have the faith that he is that God. Right? And then we can do all kinds of things.
Absolutely.
But if the reason people don't do things is they feel hopeless. Mm. And I think as people of faith, especially as Christians, our hope is in Christ. I mean, we just celebrated Easter and the resurrection. Mm-hmm. And it's if we believe that that's true, then it should be shaping everything that we're doing. It should be shaping our actions, our behaviors, our ministries, and whether we're doctors or, like I said, lawyers or whoever, we have ministries in our lives that we can be doing our part.
Yeah, and I think for me too, one thing I constantly have to tell myself, it doesn't mean you're never that faith is going to be unshakable all the time. I mean,
no, definitely not.
Lord, I have to, sometimes monthly or weekly say, hello, Mandy, did you forget that you have put all your, your faith in God? This little issue you've got to let go, because it's going to work itself out and he's going to take care of it. And same thing with my kids. I talk to patients about this quite frequently because they get so, and not that I don't get stressed out over my kids either. Lord, my best friend would tell you. And she's helped me with this too, constantly coming back and saying, it is not our responsibility to make them into, they're going to have their own choices.
Oh, yeah.
And you can't worry about every little thing that they're going to end up doing. And are they going to be this? Are they going to be that? No, you put in for one, be a good example instead of telling them all the time what to do, just be a good example of it. But putting in these foundational day in, day out ideas and examples for them, and then they will take all that you've done, and with God's grace and guidance, then they'll become who they're going to be. And because when I try to worry about the whole big picture, it gets overwhelming.
Yeah, absolutely. I mean, it's the long game. It's looking at it in the big picture and going, I'm going to do the right thing. I'm going to do the next right thing. I'm going to do that. And then that's going to play out and have fruit long term. Yeah. And that's the thing I'd encourage you, in your practice is you're doing that.
Yeah. And I appreciate your your guidance through this, because it has been hard for me. I mean,
Yeah.
I don't, yeah, it has not been, a cakewalk or easy by any means, but yeah, I think just one day at a time and
Yeah.
building it slowly and having support and relationships is.
Yeah, well, you're welcome. I mean, I believe in what you're doing. I think it's awesome. I think a lot of what we're doing is still super new, and we're doing really well. And, your business is going good and mine's going good. But what we're going to, we're in the culture that we're in right now. I hope that other people who are out there listening who feel like there needs to be a change and they can do something different. Yeah, it's risky and it's nerve wracking and it takes faith, but I think we're in the midst of a cultural shift in the next decade. And it's, get on or get off the pot, like what we're doing is not working.
Right.
And it's not working, drastically worse. Our margin for error is very, very small compared to 10 years ago, 20 years ago. I mean, that margin is just slowly shrank up to nothing. And so that stinks. And like people ask me all the time, like, how's your business doing with COVID? I'm like, I bet it's doing great because everybody's falling apart. I'm like, yeah, it is. Things are going well, but that's sad.
Yeah.
Like it's not well in the sense that I'm glad people are struggling. I'm glad they have a place to struggle.
Right.
And I'd say the same for you. Like, keep giving it some time because the margin for error is too small, and the need and the issues that people are having that are specific to them and not just a plug and play issue is getting greater. And so there's more people who need people like you who can meet with them one-on-one, who can spend the time, who can be intimate, and that's only going to increase.
Right.
So the people needing to come to you and get your services, and I mean, other doctors' services just like you are going to only increase across the country. And so, I hope that more people do what you're doing because the need is here.
Yeah, I mean, I think just if you're just looking at America and, the financial burden of our healthcare costs right now are
it's obscene.
Astronomical, and it's only going to rise. And, dementia is going to be the next, epidemic as the baby boomers are getting older, and that's scary. And, it just, diabetes is, so prevalent. And so all these different diseases, if we don't make these huge cultural shifts, I don't know what it's going to look like. I mean, we've got to.
Yeah.
I think we have a choice.
For sure. And what I would encourage people is when you hear that, it's scary, but the culture is made up of individuals, and you're an individual, and we're individuals. And so shifting that culture is like impossible, but shifting individuals is not.
Right.
And so when we say shift a culture, what we mean is influencing people, educating people so that they can make tiny incremental changes that change everything. I mean, I see it every day. I see people come in divorce, on the verge of divorce, addiction, trauma, can't drive, can't function, and have been that way for years. And then in a very short amount of time are looking at me a year later or 2 years later laughing and being like, I cannot believe that was my life. I can't believe that was our marriage. And they go on to have 30 or 40 successful years. But in the beginning of that first year, the first week, the first session, it's like, this is impossible.
Right.
And I know it's the same way with you. People are overweight, or they have heart disease, they have issues, or have the beginnings of some issue. And they're like, I can't change my family and all these things. Well, you can't. But what you can do is change incremental things at a time. And then in a year, things will be amazingly different.
Absolutely. And I think that is huge for people to realize. Just because, you have that genetic foundation or that underpinnings, it's, what we bathe our genes in and what we're exposing it to all the time that really is going to call, what we display or what diseases we get.
Oh, yeah.
We have a lot more control over than we think.
No, for sure. Yeah, you're not predestined. You definitely are predisposed for things, but you're not predestined for them.
Right.
It's good stuff. What final thoughts? This is great.
I would say, one big thing is, and I think we did touch on making it a priority. I mean, your health is not gonna change by itself. And if you make it a priority, then you seek out those individuals who can help you make those changes. But it starts with you and having the motivation and the the drive to make those changes.
Yeah.
And lot of these diseases are preventable. We didn't get into the, insulin resistance and prediabetes and diabetes and all these things, but I do a lot of checking for diseases before they get here, and we can make changes to keep you from developing these conditions. So whether it's me or another doctor, just educate yourself and make it a priority.
Yeah, for sure. Yeah, so how could they get hooked up with you? Where can they find you?
My website, www.alinehealthdpc.com. So ALINE, and then the word health, and then DPC, like directprimarycare.com. There's a wealth of information on there. There's a Join Now tab. So if you want to sign up, you just click on that tab. That pulls you into my electronic health record, and it has you input all your information. And then when you submit it, it sends me an email, and we contact you about setting up an appointment. I do meet and greets, so if you just want to come check out the clinic and see what it's all about, see if it's a good fit, we can do that as well. You can just give us a call at 425-9003. Those are the two main ways. And
awesome.
Or they can call
your
call office.
Here. Yeah, for sure. We send people all the time. Yeah, I guess I can announce it on here, but one of the new things we're collaborating with is you doing some mental health prescription and stuff like that for anxiety and depression. So I'm super excited
so I'm going to
about
kind
that.
of offer a kind of an offshoot, so you don't have to sign up for the full membership, and just do lifestyle and medication management for anxiety and depression. So that's exciting. And
yeah,
be
absolutely.
Able to help.
And one of the reasons I I'm okay with that and like it, is because I've talked to you about that a bunch. Like, if you are out there and you're going to your doctor, your primary doctor for mental health medication, and they're not sitting with you and spending any time with you or talking to a therapist, I highly, highly, highly recommend you shifting that and finding a therapist who knows you're on medication, doing work in therapy, because a lot of times medication is just symptom treatment and not, root cause issues. And so
absolutely, it's a piece of the treatment puzzle. It is not by itself going to treat the whole person. So we utilize you guys and medication and lifestyle changes to kind of treat the whole person.
That's awesome. Well, this was fun. I appreciate you doing it.
Yeah, thanks for asking me. And
yeah, no doubt.
I made it through.
You did it. You did it. You did a great job. If you're listening out there, check out Dr. Mandy Crow. I was going to call you Mary as a joke, but that's an inside joke. So, if you're excited about this podcast, subscribe, listen to it. We're on, all the things. So check us out. Love you guys. God bless you. Have a good week.